Hello, welcome. We are doing the CYO Coaches Education session today. We'll be going through sports safety and injury prevention talk. I'm Dr. Susanna Briskin. I'm one of the pediatric sports medicine doctors at University Hospitals. Thank you for joining us today. As we go through the slides, we will pause at a couple different sections to take time to reflect on a few questions and think about how the talk relates directly to your sport as a coach. Hope you enjoy the talk. In general, we know that there are over 3.5 million children who are under the age of 14 who participate in sports, and certainly the number is higher if you consider the children who are participating at the high school level. Sports at this point take up about 1/5 of all pediatric brain injury causes. So as we discuss the injuries today, we will touch a little bit on concussion. In general, over half of injuries we see from sports come from overuse, which is why educating coaches on how to warm up athletes and cool down athletes and do preventative exercises is so important. We see more than half of all injuries actually occur during practice, which means as a coach, you're typically the first person on the scene when somebody's injured. So we'll be discussing a little bit how to approach taking care of an injured athlete today also. When you're looking at the 5 to 14-year-old age range, those kids under high school age range, football is the main sport in terms of injury causes, but certainly we see a lot of injuries in other sports, including baseball, soccer, basketball, softball, and pretty much any sport kids participate in. What we tend to see is just different sports cause different joints to get injured. Certainly in football, we worry about concussions, but we see a lot of shoulder injuries as well as ankle injuries. Baseball is notorious for causing shoulder and elbow pain. In soccer, we see a lot of knee and ankle injuries, but also concussions. And each sport tends to have its own specific pattern of how people are at risk for being injured and what joints are commonly affected. When working with CYO, there's typically an emergency action plan that's put in place. This is something that should be established prior to the season. It's one of the main reasons why coaches get trained in basic life support, or what we call BLS. We also hope everybody has training in how to use one of the automatic external defibrillators, or an AED. It's very important as a coach that you understand who's part of the emergency team, who needs notified if there is an injury. Certainly if somebody's unresponsive, somebody has to be able to locate an AED and make sure 911 is called immediately. The other components of an emergency action plan to take into consideration have to do with the elements of the environment. So thinking about how you'll respond as a coach if you see lightning or hear thunder during the course of a practice or game, as well as what to do in situations where people are exercising in extreme heat. Developing the emergency action plan before the season and reviewing it with any other coaches who you're working with is important, so everybody's on the same page. You really certainly hope to have everybody prepared and ready to go should something need to be responded to appropriately. The bulk of our talk today is going to have to do with conditioning and training and helping your athlete prepare for their season and participate in exercises that may help them become stronger or faster or better athletes, as well as help prevent injury. It's super important that you understand each of your individual athletes' ability at the start of the season. Try and get an idea of what they've been doing in the recent weeks to months prior to the season. So you know that as you get them going with the season, you don't want to have any specific exercises that may be pushing them much farther than they've been going in the past. It's really all about gradual increases. You also want to think about the developmental level of your athlete. Certainly kids at different ages have different levels of coordination. They have different levels of skills, especially at the younger age ranges. And you want to think about preparing practices around what kids would be capable of so that they can be successful and avoid getting injured. You also want to think about developing your practice plan to mimic what may happen during game situations. So if you're in a sport where there's a lot of nonstop running going on, you need to make sure that you're conditioning your athlete appropriately for a lot of nonstop running. You just want to build them up gradually for that. Whereas if you're doing more of a start and stop kind of sport, which is more anaerobic training, you want to make sure that the exercises that you're doing kind of mimic that game type running. So you really want to think about what your sport entails and how you're going to build your practices around preparing people to participate safely as well as effectively. And the most important thing is recognizing that more is not always necessarily better. And a lot of times we see people fall victim of an overuse injury because they have sudden changes in activity level, or they're being challenged to do things that their body's just not capable of from a developmental perspective. In terms of thinking about avoiding any abrupt changes, we really recommend following something called the 10% rule. It's essentially a gradual increase of training which doesn't affect either duration, frequency, or intensity more than 10%. So if you have an athlete who has been doing cross-country training through the summertime, and they were on a running program for 3 days a week, and they were running 3 miles, and they built up to that, and they were doing well, and then cross-country season officially starts, and as a coach, you bring them in and you start running them 5 to 6 days a week for 5 miles, you're increasing their frequency of how often they're running, as well as how long they're running for, a significant amount. And that athlete will be at higher risk of developing an overuse injury, such as a stress fracture, and you want to really avoid that. That's really the main reason why you have to have a good understanding of where your athletes are coming into the season, so you can avoid those abrupt increases in training. If you have somebody who's been very inactive, then it's crucial that you build them up slowly and you limit how much training they're doing, especially from an impact perspective. The majority of problems we see with individuals not following the 10% rule comes from that impact with contacting the ground. So running, jumping exercises are really where you have to go gradual. The other area to consider going gradual is things like overhead work. So for somebody who's a baseball player or softball player, if they haven't been doing a lot of overhead throwing, you may need to build them up gradually to try and avoid an overuse injury. When you start practice and end practice, you always want to make sure people are having a good warm up and cool down. It should be part of every practice as well as every game. It's super important just to take this time to participate in the warm up and cool down with your athletes, demonstrate how to do it appropriately, and certainly work to be a teacher and make sure that young kids are doing everything appropriately. The younger the kid is, usually the less likely they are to perform the exercise properly. So oftentimes people need monitored and given reminders on how to do it on a frequent basis. The whole point of doing stretching as part of a warm up and cool down is really to help prevent injury. It can help performance. We also see post-exercise stretching really help prevent some of that delayed onset muscle soreness where people get really sore after exercise 1 to 2 days later. For individuals who are growing rapidly in those middle school and early high school years, we think that people tend to have significant muscle shortening and tightening up during this time, and that affects their flexibility. And with poor flexibility, we can see people develop knee pain, hip pain, and back pain. So really working on developing that flexibility through those quick growing years is important. So when you're looking at teaching stretching, there's a couple things to take into consideration. We recommend before activities doing dynamic stretching, which is more stretching in motion is the best way to think of it. There's different ones reviewed on this slide. In particular, we talk about trying to really do dynamic stretching in those lower extremity muscle groups on this slide. So you can see what we call a walking glute stretch, where literally you're just walking, you're pulling that knee up to the chest and giving it a good squeeze, taking another step and switching sides. The walking quad stretch is almost the mirror opposite of that, where you're walking, you're pulling the heel up towards the buttock and giving it a good squeeze and then moving on to the next leg. And you really just want to alternate back and forth. Next, you see in the middle of the slide, some linear and lateral leg swings. So these are excellent hip warm-ups where you're really just trying to do crossovers with each leg. You'd want to do both the right and the left leg for this also, followed by on the far side of the slide, the hurdle stretch. So this is essentially, you're thinking about having that stretch kind of go up to the side with the hip and then bringing it back down and forward, and really bringing that hip forward and backward will get those muscles warmed up very nicely from a dynamic perspective. The dynamic stretches are nice because they're going to help warm up muscles as well as joints working in the range of motion of where you're going to see them moving during exercise. So you can imagine somebody who's running is going to have their hip moving in the extremes of flexion extension, and all these stretches are going to kind of tackle that area. Other things to consider before have to do with starting to think a little bit more about some trunk work as well as the hip. So iron crosses is essentially in that top left of the slide, bringing the leg fully across the body, and then you can swing it back. Scorpions get that trunk rotation going. So you're laying on your belly and you're rotating your hips over and trying getting them off to the side to stretch that low back and those abdominal oblique muscles. Donkey kicks warm up some of the glute as well as the hamstring and a little bit of the hip flexors as you come forward. Donkey whips are more out to the side. So here you're tackling a little bit more of those groin muscles, as well as the groiner stretch does the same thing. For these, it's really best to do them last once you've warmed up the other muscles around the hip. And I tell people all the time, especially if they're prone to groin injuries, to kind of take these slowly. Once you've done all these excellent dynamic stretches, doing something up on your feet like a karaoke line, doing some skipping forwards and backwards, some high knee running, anything that's a little bit more dynamic that mimics running is not a bad idea. Body weight squats help warm up those hip flexors and arm circles, get the upper body going a little bit. When you're thinking about after sports, that's really when you start to think about the more traditional static stretches that we've all been brought up doing in life. And when you're looking at these stretches, you can see they kind of tackle all the different body parts. You have arms going across the body, trying to stretch out those delts. Just below that, you're hitting the triceps. You can hit the quads with a more traditional heel to butt stretch, but this is a hold. So this is going to be static as opposed to the dynamic where you're bringing the leg up, giving it a good squeeze and switching to the other leg. All these exercises where we do a hold, we usually recommend holding for 30 seconds. I always tell people it's best to use your smartphone to set a timer to count out the 30 seconds because we typically count a lot faster than we would using the timer. So you want to get the benefit of that full 30 seconds for each of these stretches. And you also want to think about making sure that you're doing each individual stretch at least 2 to 3 times to revisit the muscle group and make sure that you're getting it a really good stretch. And you can see on this slide, you know, even the hamstring, there's a hammy 1, hammy 2, and toe touch, and all 3 of those do get at the hamstring. So you don't necessarily have to do each of those hamstring stretches 3 times. You can pick which hamstring stretch works best for you and then tackle that one. One of the other activities you want to think about including in your practices would be strengthening of the athlete's core. We also recommend building in balance exercises. When you're thinking about building these in, core strengthening is usually pretty easy to build in. The abdominal muscles, the gluteal muscles, and the back muscles are the main muscle groups that you want to attack with this. Instead of doing traditional sit-ups, easy exercises to build in would be planks, where you have the athlete down on the ground. They be on their tiptoes and have their arms bent and have the elbows fall right underneath the shoulder. You can hold this position. You want to really try and encourage the athlete not to have their buttocks sticking up in the air or their pelvis getting lowered down to the ground. They should have a nice flat back and they should work on holding the exercise. You can start for 20 seconds and do multiple sets at 20 seconds. For stronger athletes, you should start building them up and try and get them to do 3 to 5 sets of 1 minute. These core activities are really good for helping prevent individuals from developing back pain, but they can also help you from an athletic perspective. The core is really our main muscle group that helps us move the body, and the strength that comes out of your core is really extended out to your extremities and can help you become a faster runner. They can help you become a stronger hitter or a stronger thrower, and they're really key to preventing injury. Balance exercises can also help prevent ankle sprains. We recommend having an athlete take their shoes off if possible to do the balance exercises and just work on balancing on a single foot at a time, doing sets of 20 seconds to start and building up towards a minute. If you want to make it challenging, you can even do short sets and have the athlete close their eyes to work on balance. Multiple sets of exercises that focus on balancing help prevent those ankle sprains. Next, in terms of conditioning and training, you want to think about how you're going to help an athlete in the weight room. We really recommend young athletes do low weights with high repetitions and avoid powerlifting. But the most important thing is teaching athletes appropriate form in the weight room. You should always start with just body weight exercises, such as body weight squats, before you move to adding weights onto an individual. The other thing that's important, especially for one athlete who may be specializing in sports, is to recommend some cross training. Individuals should have at least 2 weeks of rest scheduled twice during the year, but it's also appropriate during the season to make sure every athlete has at least 1 day off for recovery a week, and even considering mixing in a cross training day where maybe instead of having an athlete run, you have them bike, or do a different sports movement can be very beneficial in terms of helping them prevent injury. So here we're going to pause for a minute. I'll just read these questions out loud. You can think about how what we've discussed is related to the sport that you're coaching. First question, what type of stretches would you recommend or think about implementing within your own practices or pre and post game? What type of stretches are you going to do kind of on a consistent basis with your athletes, or are you just going to build in when you need them on game days? And then what's the point of really training just the whole core as opposed to the abs, and what exercises can you do to reinforce this within your practices? We're going to move on from the injury prevention warm-up and talk a little bit about common injuries that we see in athletes, both acute as well as some chronic or overuse pain, and talk a little bit about injury prevention. So as I mentioned before, the majority of injuries actually happen within the practice setting. So it's very common for the coach to be the first to identify the injury and be on the scene at the time. Athletes tend to be at risk for injuries related to growth plates when they're young, so we'll touch a little bit on those. Certainly, if you have somebody with an initial injury, if they're comfortable enough and they can weight bear on their extremity and you don't have access to an athletic trainer, the best thing to do is at least remove them from your practice. If you have the ability to get them any protections, such as crutches, if they can't weight bear, then go for it. But even just having somebody ice immediately for 20 minutes, getting some sort of compression like an ACE wrap on it to help control the swelling, and then always elevating the injured extremity can be very beneficial. And in terms of elevation, I always try and remind people you really want to get it above the level of your heart, not just elevated off the ground. So that's a super important thing when you're thinking about, sending an athlete home who twisted their ankle. You don't want to tell them just go sit on the sofa and put your foot on the coffee table, because then the injured extremity is just going to be at the level of the hip. You want them either flat on the ground with their foot up on the sofa or coffee table, or you want them laying flat on the sofa with their leg propped up on the end, probably under a couple pillows. That really gets extremity up above the level of the heart, helps decrease the swelling, and can be beneficial. I also recommend, in terms of icing, that after 20 minutes, you always remove the ice. You should not place ice on the injured extremity again until the skin's back to normal temperature and color, and this helps prevent frostbite. So the typical rule of thumb is 20 minutes every hour, but certainly, you can space that out if they don't need it for pain control or swelling purposes. So if you're on the field and something happens to an athlete and you're trying to figure out whether or not you need to call 911 for assistance, there's some pretty basic rules to follow. First and foremost, if anybody has loss of consciousness or is unresponsive, you want to contact 911 right away. If there's a suspected neck injury where there's some sort of contact mechanism or awkward fall, and individuals complaining of any neck pain, and certainly if they're complaining of any extremity symptoms with numbness, tingling, or weakness, you don't want to move that athlete at all. You want to help get them assistance right away by calling 911. Certainly if somebody has a hard fall and you see any sort of deformity of an extremity and you suspect that they've broken something, getting them assistance right away through 911 is certainly helpful. Likewise, a joint dislocation, which can be quite painful. And then if you're concerned from a heat illness perspective, and we'll go through this a little bit near the end of the talk, but really from a heat illness perspective, if you're worried about severe dehydration, you really have to worry about getting somebody cooled immediately if they start to have a change in mental status. In most cases, that comes across as not acting right, somebody who can't answer questions appropriately, they're confused, their speech may be garbled, and in that situation, calling 911 and getting the athlete cooled immediately in the shade, getting them some water, trying to get some ice packs on them is very beneficial and can really help them recover. When is it okay to send with the parents? Certainly if you have a small laceration where there's a cut in the skin and the bleeding's easy to control, if they have a fall on an extremity but there's no obvious deformity, they just have pain, maybe even some swelling, certainly if the parent's comfortable taking them to get looked at, that's fine. Any bruises or deep contusions, all those things are usually fine to send the athlete home with, and certainly they'll need guidance as to where to go get assistance. So you always want to think about where the closest hospital may be towards your practice location or even where your game's being played. It certainly saves a lot of time when people are stressed out and an athlete's injured, if you know off the top of your head where the closest location is where they can get help. When we're thinking about common bone injuries in athletes, it's certainly important at the youth level to consider the growing areas. The growing portions of the bone are much more likely to be injured in kids than the muscles or tendons. We call the location where the muscle attaches to the bone an apophysis, and we see people develop what we call apophysitis, which is inflammation or irritation on the bone right where the tendon attaches. The most commonly known one is Osgood-Schlatter. Osgood-Schlatter is irritation right where the patellar tendon attaches, and it's something most people are familiar with when they start to see those early teen years and people developing bumps on their knee and getting pain, and that's because that strong quad muscle is recurrently pulling, and instead of getting adult form of patellar tendon pain, they actually get apophysitis right where that tendon from the quad pulls on the shin bone. We can also see fractures off of the apophysis. So if somebody has a sudden pop either around the knee or around the hip more commonly, and they're having trouble weight bearing, we certainly worry that you can fracture through this growing area. And that's another thing to consider. If an individual is just having some ongoing pain, maybe they can't run as fast as normal or kick a ball as much as usual because it's bothering them, we really recommend basic treatment with consistent rest and icing, and avoiding aggravating the spot on a recurrent basis. If the pain is lasting more than a week or it's really debilitating and they're limping or can't participate in practice, that would be a reason why you'd want to refer them in to see a sports medicine physician to get assessed. Ankle sprains are certainly one of the most common injuries we see in sports, and it happens across multiple sports. So regardless of what you coach, you're likely to see one. We try and educate coaches that if you have an individual who's really under the age of 12 or 13 and they roll their ankle and they develop swelling and certainly trouble walking on it, that it's actually more likely that they developed a fracture in the ankle around the growth plate on the outside fibula bone. That growth plate is a weak link as opposed to the ligament, which tends to tear in adults. So if you have somebody who's young and rolls their ankle and swells or rolls their ankle and can't put weight on it, that would be another reason why you'd want to refer them in to see a sports medicine doctor. At that juncture, they'd likely get an x-ray and the doctor would determine whether or not a sprain is present or a growth plate fracture itself. The ankle sprain affects the ligament on the outside of the ankle, most commonly the anterior talofibular ligament. With that, we certainly also can see swelling and pain and trouble weight bearing, and really differentiating between an ankle sprain and a growth plate fracture is up to the physician because it's determined really on the clinical exam and seeing where the patient is most sore. Again, if it's just a regular ankle sprain, a lot of times we can get away with resting and icing and doing a compression wrap and sometimes unloading on crutches if need be. But early motion can be very beneficial for recovering from an ankle sprain as opposed to a growth plate fracture, which you need to immobilize. So differentiating between the two can help get the athlete back on the field safer and oftentimes faster if you know how to treat it properly. Here's a nice picture of Osgood-Schlatter. You can see the bumps on the front of the knee, most probably on the right side for this patient. It's a super common problem for kids in those early teen years. It kind of depends where you are in terms of your growth, but we can certainly see it as old as 15 or 16 in boys, as old as 14 or 15 in girls, and the onset tends to be right around the break into those teen years. You can develop pain there. Osgood-Schlatter can start all of a sudden when somebody has a hard fall on the knee or maybe goes knee to knee on the basketball court or soccer field and they bang together and you develop discomfort immediately. More commonly, we see people get Osgood-Schlatter just from the repetitive use of the lower legs with running and jumping. Again, resting and icing can be very beneficial. Oftentimes we x-ray these individuals to make sure there's nothing else going on in the bone. And then we get them onto a good stretching program. Consistent stretching in the quads and hamstrings can be beneficial. And we oftentimes will recommend a brace to help control the pain and help an athlete participate in sports safer. If the individual's not at the point where the pain's so bad that they're limping and miserable, they can usually participate in sports safely. But if you have an athlete with this who's developing pretty significant pain during practices or games and they're at the point where they're limping, we usually recommend you rest them on the sidelines and have them ice. Heel pain is another common location for individuals to have discomfort. The heel has a growth plate in it that usually opens around age 6 or 7. We oftentimes see it close around age 12 or 13, but again, it depends on where the individual is with their growth. The most common sports for people to develop growth-related heel pain, which we call Seaver's disease, is oftentimes a cleat-wearing sport. So it's very common in soccer, baseball, softball. We'll even see it in football and lacrosse. And the other sport where we commonly see it is basketball because of the recurrent jumping and running involved in that. The heel pain, again, you treat very similar to Osgood-Schlatter. If somebody's at the point where they're miserable and limping on the field, you want to rest them. Otherwise, we have them ice on a consistent basis. We get them to stretch their calves consistently, which can help. And then the main thing we do is we oftentimes put a little heel cup into their shoe. And this is a nice squishy gel cushion that helps avoid that heel growth plate striking the hard ground in an unsupported cleat. And it can have a lot of benefit for people. So when you're thinking about injuries, you may want to stop and just take a minute to think about what injuries you've seen over time as a coach, or think about what injuries you may see as you approach your upcoming season. You can put yourself in the position of being on the sidelines and imagining what you're going to do if somebody comes down and rolls an ankle. How are you going to help that athlete? When would you want to call 911? When would you want to send them home with a parent? Would you be okay with them coming back to practice without evaluation by a physician? Think about how you would handle those steps before they even happen, and it's a good way to prepare for the season. And certainly, you know, recognize the fact that the injuries are much more likely to happen in a practice situation where you may be the only adult there, or maybe you have 1 or 2 assistants. How are you going to handle a situation if somebody is injured? We're going to move on to concussion. We're going to keep this real brief because we recognize that all coaches already have mandatory concussion education through the state. Concussions are certainly much more common than they've been in the past. We see individuals have a blow to the head and develop symptoms, but even a blow to the body where the head gets shaken around can cause signs and symptoms of concussion. Common signs and symptoms that you want to think about with concussion are certainly headache, nausea, any vomiting, any confusion or not acting right, trouble with light and noise sensitivity, the patient not feeling like themselves and feeling foggy. All those are atypical. And even if you take a hit to the head and you develop a single one of those symptoms, you by definition should be held out because there's concern for concussion. The other thing to consider is the fact that the majority of people don't lose consciousness when they have a concussion. We see 90% of concussions occur and no loss of consciousness occurs. Certainly if you're in a situation where somebody does have loss of consciousness, regardless of if it's a practice or a game, you want to call 911 immediately. But when in doubt, we always try and get coaches to understand somebody hits their head and they have any concern for a head injury, your best bet is always to hold that athlete out. We know that individuals recover much faster from their concussion if they don't go back to the practice or game. They don't have to take a second hit to the head to worsen. Just even going back and running around and exercising after you've had your head hit can oftentimes cause the symptoms become longer and harder to get rid of. So if somebody hits their head, we request that you just sit them out and then make sure they get a medical evaluation. Certainly as part of the concussion awareness training, you can consider things that would make you think about concussion. So we already kind of talked about what signs and symptoms you'd think about. What persistent symptoms would make you want to send somebody to the emergency department. So if you're on the sidelines and somebody does have a head injury, if the individual's not acting right and doesn't seem like their usual self, you want to send them to the ER. Anybody with loss of consciousness, anybody who is vomiting, anybody who seems significantly confused or is complaining of a severe or worsening headache, all those individuals should be sent to the ER right away. So if they end up in the hands of a sports medicine doctor after their concussion, what can you expect us to do as a provider? We typically take a thorough history to get an idea of what exactly happened and caused the concussion. We'll do a full medical evaluation as well as a thorough neurologic exam. We do memory and concentration testing in the office, and we perform balance testing. And then we really put into place a plan for recovery. So we talk about whether or not an individual can return to school, whether or not an individual is ready to use electronics or if those should be restricted, and when is it safe to start up exercise. As you probably already know from your concussion training, athletes are returned to play in a gradual manner, but they typically are not allowed to start the return to play protocol until all their concussion symptoms have fully resolved and their memory and concentration and balance testing have returned to normal. In terms of preventing concussion, the best thing to do is to make sure that athletes have appropriate equipment that fits well. I always try and educate athletes as well as coaches that helmets and mouth guards have not been shown to prevent concussion, but certainly having a helmet on that fits poorly and moves won't protect the head, as well as a helmet that fits the athlete well. I also tell people if you're participating in an activity where a helmet is optional, such as biking or rollerblading or snowboarding, you're best off always putting one on your head, because there is good evidence that they help prevent skull fractures. And certainly skull fractures are not an injury you want anybody to have, but it even holds you out oftentimes longer than a concussion would. Other things you can do from a preventative standpoint is make sure that you're following the rules. You have good training for your athletes in football on how to tackle properly, and you reinforce how to tackle properly in the practice setting. You want to respect players. If somebody comes to you and says they have a headache, it's best off not to dismiss their claim. It's best off just to give them the benefit of the doubt and sit them out and make sure they get the medical care they provide, and always err on the side of restricting their activity until they can be evaluated by a medical specialist who takes care of somebody with concussions on a regular basis. As we talked about before, certainly if you have an unconscious athlete, somebody who's not responsive, you always want to assume they have a cervical or neck injury. Call 911. Don't move the athlete at all. It's much more likely if somebody has a neck injury that if they're complaining of pain or numbness or tingling or weakness, that the spinal cord is affected. So it's super important that you don't remove any helmet or shoulder pads if somebody's unconscious, or reposition the athlete in any way. If the athlete regains consciousness while you're waiting for emergency assistance, it's always best to immobilize their head and neck and wait for help to arrive. We're going to switch gears a little bit and talk about some hydration and nutrition. Certainly in the hot summer months, the hydration component is more important than in the cooler winter months in Ohio. I always get people to try and understand that as soon as you are thirsty, you're already 3% dehydrated, and that's going to affect your performance. We see issues with sports performance develop as soon as somebody's 1% dehydrated. So you want to think about being proactive with hydration and really trying to make sure people are drinking ahead of activity, especially on hot days. You also want to think about how you're building out a practice schedule, especially if you're exercising your athletes through the summertime. If you're doing sports through the summertime, you want to make sure that people have enough time to rehydrate between their training sessions and not schedule them too close together. In terms of thinking about an adolescent for hydration before activity, we usually recommend 16 ounces of water about 2 to 3 hours prior to sports. This gives the individual plenty of time to drink the water and then make sure they can make it to the bathroom prior to getting to the sports field. And then this is really where your break time is important. You never want to restrict giving your athlete water breaks. It's much more likely to lead to heat illness related problems, but it will also affect their performance. We encourage everybody to have their own water bottle on the sidelines. On hot days, sometimes people need to show up with multiple water bottles or large chug jug in order to have enough water on hand to drink for longer practices in hot weather. People should be getting about 8 ounces of water down every 20 minutes. If you can do your water breaks in the shade on hot days, that's also beneficial. And then one of the most important things as a coach is to actually encourage your athletes to drink after sports. So you really want to push the fluids within those first 2 hours. Typically on a hot day, people sweat at different rates, but the majority of people need between 24 and 32 ounces in order to replenish all the fluids they lose through their sweat. The easiest thing to tell athletes to do is just drink until you have to go to the bathroom about once an hour and the urine has turned a nice light yellow or clear color. And then you know that you've been rehydrated well. So drinking between activity is super important. I always tell people water is appropriate for any sports going less than 60 minutes, but certainly if it's a hot day or you're exercising for longer than 60 minutes, you could think about replacing the water with a sports drink or doing a half and half water sports drink mix. You want to avoid doing anything that's super high in sugar, like orange juice, or doing anything that's caffeinated, like one of the caffeinated pops, or even one of the caffeinated beverages that some people drink. So it's super important to make sure athletes understand what to replenish and how to replenish their fluids, because it's not only going to help them with performance, but also help prevent heat illness and injury. When you think about the spectrum of heat illness, it certainly runs the gamut. You think about the majority of people having issues with heat cramps as a mild form of heat illness. Here, you tend to lose salts as well as water due to repetitive exercise. Most commonly affected is lower extremities, such as calf muscles. If somebody is cramping on the sidelines, the best thing to do is get them into a cool area. If they have the ability to drink a sports beverage to try and get that salt back into their body, it's probably best to do so. If you don't have access to a sports drink right away, if they have any sort of salty snack packed in their bag, you'll want to have them eat that. And then stretching out the muscle group and icing it can sometimes help get the symptoms to subside. But the majority of time, it's all about rehydrating in order to get more fluid into the body. One of the more moderate forms of heat illness is called heat exhaustion. Here you can start to see significant fatigue, nausea. People will still be sweating, but they may develop a headache. Again, real common in those hot August days when people are doing long practices. This is the sign that you really want to get an individual out of the sun, because if you don't address this, it could be progressive and develop heat stroke. So you want to try and get them into a cool space. If you can elevate their feet and start having them drink small amounts of water or electrolyte replacement fluid, if it's available, it's not a bad idea. The main thing to do is really try and assess how they're acting. The one thing that differentiates heat exhaustion from heat stroke that you would be able to identify as a coach on the sidelines without any equipment would be disorientation. So if somebody starts acting like they don't know where they are or what's going on, that's when you want to activate the emergency system and call 911. If you have access to ice bags and you can put them on their neck or in their groin or armpits or on their head, places where we exchange a lot of heat, you can help cool them right away. Certainly if you have access to any sort of ice bath where you could submerge them in water, that helps. But stripping off any extra equipment, trying to get them into just a thin layer of clothes in the shade, and calling 911 is the most important thing to do, because heat stroke is life-threatening. Like I said, the main thing that differentiates it from heat exhaustion is that disorientation or confusion. The best thing to do is try and prevent it. So when weather is hot and humid, you want to make sure you're giving extra fluid breaks. Kids are most at risk at the start of the season when they're not acclimated. The majority of kids can take a full 10 days of exercising outside on a consistent basis in hot weather for their body to adjust to it and learn how to decrease their body temperature and not become overheated effectively. Kids who are heavier weight are going to be at higher risk, as well as younger kids, because their systems just aren't as good at controlling their body temperature. The main thing we always tell people is don't use a headache and don't use heat illness as an excuse for somebody with a headache and say, oh, they're probably just dehydrated. If somebody's involved in a contact sport and they develop a headache, you're always best off acting as if it is a concussion and just restricting their activity. From a nutrition perspective, you certainly as a coach have a lot less input because you're typically not the one providing food for individuals, but certainly recommending good quality nutrition is important for your athletes in order to have them perform well. one of the most important things to do is make sure that people are eating a good small meal before they participate in sports, and then really trying to replenish what they've lost immediately after sports. I try and get athletes to carry the portable chocolate milk boxes and put them in their bags. Consuming food within 15 to 30 minutes of the conclusion of practice is the best way to replenish. Chocolate milk is kind of a double bonus because you get the fluid replacement, but you also get significant protein and carbs, which is really what you want to replace your losses with. It helps you build muscle faster. So I really try and get athletes to pack something in their bag because the bulk of the time people can't get home within that time window and get food prepared. So encouraging your athletes to have a portable chocolate milk or a snack with some balanced protein and carbs, like peanut butter crackers if they don't have a nut allergy, is a good one. Pre-game, you want to think also about a little protein and carbs, but you really want to make sure people are eating a full meal at least a minimum of 2 hours before competition so they don't get an upset stomach. And then right before competition, having a small snack on hand is also not a bad idea. And that wraps up our talk for today. We encourage everybody to follow us on Facebook at University Hospital Sports Medicine. We also have a website available, uhsports.org. And if you have an athlete who you think needs referred in to either have an injury evaluated or to talk about a concussion potentially, or injury prevention or nutrition strategies, we're certainly happy to see them and help them out. The easiest number to remember is 216-983-PLAY, and we can get athletes scheduled in with us on a fast basis. We hope you've enjoyed the talk today, and most importantly, we hope it helps you become a better coach and more prepared on the sidelines. Thank you for joining us.